My name is Tara Flackus. I came from Gardner, Kansas. I have occipital neuralgia, and he took the nerves out, so I don't have that pain anymore.
Tara originally came to us with pain, headaches, effectively, in the back of her head that kind of started at the base of her skull, going down into her neck, and then radiating up to the top of her head.
Definitely not the same person with the pain. My children, my patients, the noise, the sounds all just reverberated. Is that the proper word? And so I was not as present as I would have liked to have been for my children, for my husband. After the first visit, he said he would do the surgery, and I was a little nervous about feeling numb. And I went home and ended up having to have a decompression surgery because it got so bad. But that also didn't work, so I came back.
And so we did some nerve blocks here in the office. We used a local anesthetic to numb up the nerves, and we did this using ultrasound guidance so that I could make sure that the nerve block was going exactly where I wanted it to go. And I did the blocks myself in order to simulate what a neurectomy might feel like. In other words, to disconnect these nerves. The downside of disconnecting those nerves or removing them is numbness in the area where those nerves used to go. This is way better than the pain I've been having for all this time. Can we go ahead and do that? I mean, I've done a lot of occipital nerve surgery, but hands down, her greater occipital nerves were the largest greater occipital nerves I've ever seen in anybody. They were at least 3 times the size of the next largest ones I've ever seen in another patient.
Oh my gosh, allowing my kids to have friends over. They're poor kids. I tell them all the time, it's too much, I can't manage it, but I like to bake with the kids. I like to make cookies and pancakes or whatever. Do the research, and that's what we did, and that's how we found Dr. A. He just is phenomenal what he does, and his crew is amazing. They are so wonderful. It's almost like you all acted as if you did know me. And so that helped me, and that was an amazing experience to come in and have people who cared like you guys did.
I'm really glad that we had the opportunity to help her, and I'm really looking forward to trying to help other people like her. If that story touched a part of your heart, then please consider helping us touch the hearts of other people who otherwise wouldn't be able to afford specialty care like we provide here in our practice. Through Healing Hands of America, the M25 program restores hope to people who find surgery otherwise financially out of reach. The M25 program is a unique and innovative approach to providing medical care for people who have financial difficulty. It allows them to be able to invest in themselves through community service and invest in their community through that community service. And that gives us a way to also invest in those patients and invest in their care and their future. If this is something that interests you, I'd invite you to take a look at our website, m25program.com, and learn more about the program there. You can also use that link on that website to make a tax-deductible charitable donation to help support the program and help us deliver care to people that otherwise would find it out of reach.